Thank you so much for that session. We are going to now ask our two presenters some questions. And because we're running a little bit early, we're then going to have a short break and then we're going to go into the final section. So the first question for Dr. Kapferer-Seebacher. Do you have any tips for dental care?
Yes, I have. A lot of people ask me which toothbrush they should use. And what I can tell you that it is not that important which toothbrush you use, but it is very important that you have a systematical brushing method. This means that you should start always with the same tooth, for example, with the molars in the back of the mouth, and then you brush the first molar and you stay there for 5 seconds, 1, 2, 3, 4, 5, and then you go to the next tooth, and then to the next, and then to the next. And recent studies from Germany have shown that this is the most important factor that you clean your teeth efficiently, more important than the toothpaste and the toothbrush and the time of brushing.
Thank you. That's really helpful. Dr. Lepperdinger, do individuals with periodontal EDS have other problems with their immune system, for example, increased susceptibility to bacterial infections elsewhere? Oh, you're muted. We can't hear you.
No, she has problems with her microphone, I think. Okay, I will answer the question. Okay.
Thank you. You can mine. See if it's the same.
So not really. I mean, we have some individuals who reported on an increased prevalence of, for example, otitis media, and some people have more blisters in their mouth, recurrent blisters. But it is not like with neutropenia, where you have a lot of recurrent infections.
Okay.
So we are not sure at the moment.
Fair. So I'll stick with you then for the questions, if that's okay then. How can people protect their gums when brushing and flossing?
You mean that they don't damage the gums?
Yes.
Okay, so when you have healthy gums, it is very difficult to damage them. I mean, if you take a needle or a sharp knife, then gums will bleed. But if you brush your teeth efficiently, they don't bleed and you can't damage them. You should not use a very hard brush, and you should not use a lot of force to brush them. I mean, you have to brush them gently, but then you don't damage them, no? It may be different with periodontal EDS because they have such thin and fragile gums, but also the gums of people with periodontal EDS are very sensitive. And that's why they brush very gently, because the gums are so sensitive.
Thank you. Is there any treatment for periodontal EDS?
Not yet. What I observed with the patients I am following is that when they perform really strict oral hygiene, the periodontal destruction stops. But it is very difficult, especially in the for teenagers, to brush their teeth efficiently. And yes, we don't have another treatment at the moment. We think about developing a toothpaste which inhibits the classical complement pathway, but we are at the very beginning of the development with this toothpaste.
Okay. And what precautions should dentists and oral surgeons make when examining and working within the oral cavity of a patient with pEDS?
You don't need special precautions, but what I observed is that the gums are really very sensitive. So if you touch the gums or you do periodontal probing, and you do it with the same force as for other people, then it hurts extremely in periodontal EDS. Yesterday in the research meeting, I learned that EDS may be associated with an abnormality in innervation of the skin. And now I have the hypothesis, since yesterday I have the hypothesis that maybe there's also different innervation of the gums. So the dentists have to be very gentle.
I love that. The whole purpose of ECHO is all teach, all learn, and just what we've been doing over the last few days, that people are still constantly learning from peers and colleagues, and the importance of these research meetings. So that's great to hear that all these things are being discussed. Okay.
May I say something more? Because
yes, please.
About this abnormal innervation of the skin, and because there is a very new paper reporting on oral health related quality of life in people with EDS. This paper showed that people with EDS have a very low oral health related quality of life, mainly because of pain. But when the authors looked at the oral health and the prevalence of caries, it was the same as in other people. So this is very strange, you know. The oral health is the same, but the quality of life with oral health is reduced. And I think maybe this is because people with EDS, maybe they feel more pain. Yes, I will have to think about this, and maybe we do research on this.
Interesting. Well, I look forward to seeing those research applications. Are there any contraindications to orthodontic treatment in EDS in all of the rarer types?
I don't think so. There are only some case reports reporting on orthodontic treatment with EDS, and there seems to be a higher risk for relapse. So you have to retain the teeth with a wire inside the mouth, and maybe also with splints, but there is no contraindication now.
And can EDS affect the healing of the gums after a surgery of wisdom teeth extraction?
I don't know. There are no reports on healing after extractions.
Okay. Is immunoglobulin A significant in mouth health? About 14% of EDS have some immunodeficiency, including IgA deficiency or common variable immune disorder.
The only immunoglobulin which is active in the mouth is immunoglobulin A. So I don't think that this may play an important role with EDS, no.
Okay. Well, that brings us to the end of our questions for this section. Thank you both so much for your presentations.
Thank you very much.
So when we come back after the break, which I think is 8 minutes long, we are going to be talking to all of our speakers that have been present today, and we're going to have a chance to ask all the questions that we didn't have time for. We're also bringing back our scientific chairs, Professor Maufey and Dr. Schucker, and we're going to talk about, they're going to have a recap about the day, thinking about the conversations that we've had, but also looking ahead to what kind of rare EDS issues there are, potential future developments, and how we can all work together. And also they can report back on thoughts following the research meeting we had yesterday with members of the consortium, and this morning with the European reference networks and European groups. So please do tune back for the last section, and we'll see you then.